Hello everyone. Here we are going to cover an important topic, that is portal hypertension. In your university exam, you usually get a short question on the consequences of the portal hypertension, especially on the ascites, varices, splenomegaly or hepatic encephalopathy. So we will see all the consequences and their pathogenesis in detail. So let's start the topic, the important topic. Portal hypertension. So let's start the topic, portal hypertension. So first of all, I will let you know the overview under which the headings under which I'm going to describe this topic. So first of all, I will let you know the definition of portal hypertension. What do you mean by portal hypertension? Then we will see its definition. We will see the introduction. We will see the definition. Then we will see the classification of portal hypertension. How many types of portal hypertension is there? Then we will see the various causes of portal hypertension. Finally, we will see the sequel of portal hypertension, which is ultra important. You get many questions on the sequel. So there can be ascites, there can be varices, splenomegaly and hepatic encephalopathy. We will see the pathogenesis of all four in detail. How does they occur in portal hypertension? So let's start the topic, portal hypertension. For understanding portal hypertension, you must understand the dual blood supply of the liver. You can see the dual blood supply of the liver here. You all can appreciate this is liver. What do you mean by dual blood supply of the liver? You can see this is liver, and all the organ get pure blood, oxygenated blood from the heart, from the left side of the heart, from the aorta. So liver is also receiving the pure blood, the oxygenated blood from the aorta with the help of hepatic artery, via hepatic artery. So first blood supply in the liver is the hepatic artery. We all can understand. What is the second blood supply? The second blood supply in the liver is from the veins of the GIT. Can you see the veins of the GIT? Veins of the GIT drain in portal vein, and portal vein first drains inside the liver. So second blood supply in the liver is the portal vein. So this is the dual blood supply. I hope you got it. So liver is getting double blood supply. What are the two blood supply in the liver? First is the oxygenated blood coming via hepatic artery from the heart, from the left side of the heart. And second is portal vein. That is deoxygenated blood coming from the veins of the GIT, that is portal vein. So the blood from the hepatic artery and portal vein that is coming inside the liver mixing, but the exit is one. The exit of both of them, the drainage of both of them is one. So you can see here is the drainage. So drainage of both of them is one. Let me tell you the drainage, that is hepatic vein or central vein. So via hepatic vein or central vein, the impure blood, the deoxygenated blood is drained out. It is drained out of the liver into the inferior vena cava and into the right side of the heart. So although there is a dual blood supply, so entry is two. One blood is coming via hepatic artery, one is coming via portal vein. So after coming the two blood, they are mixing and the exit is one. The exit is the vein, that is hepatic vein or central vein, that is the exit. Now why does the God has provided us liver? The God has provided liver to synthesize the bile. So inside the liver, the cells are there which are known as hepatocyte, and they synthesize bile. So the bile synthesized by all the cells is accumulated at one place. It is accumulated at one place, and it is accumulated and exit the liver via bile duct. So this is the bile duct. You can see the two entry in the liver and the two exit in the liver. The two entry is the dual blood supply. One is hepatic artery, you all can see. One is hepatic artery, one is portal vein, that is the two entry. And the two exit, one is the blood exit. The two entries there, but one is blood exit, that is hepatic vein, and one is bile duct, containing bile but not the blood. So this is the thing. Now whenever there is cirrhosis of the liver, imagine the liver is having cirrhosis. So cirrhosis is a disease in the liver. I assume that you have watched my video on cirrhosis. So there is a separate video on cirrhosis. If you have not watched that, please watch that first. So whenever there is a cirrhosis in the liver is injured, the liver is cirrhotic, it is end stage cirrhotic. So liver will not accept the blood from the portal vein. So this is the portal vein, you all can appreciate. This is the portal vein. So liver is not accepting the blood from the portal vein. You can see it here. So let me highlight the portal vein again. So this is the portal vein. So since the liver is damaged, it is not accepting the blood from the portal vein. So the portal vein pressure is increased, and that is known as portal hypertension. So portal hypertension is a consequence of cirrhosis. Whenever there is a cirrhosis of the liver, there is an obstruction to the flow of the portal blood flow to the liver, and there is increased pressure in the portal system. That is leading to portal hypertension. If we measure the pressure in the portal vein, if we measure the pressure here, normal pressure is 10 to 15 mm of saline. So if you measure the pressure in the portal vein in a healthy individual, it is 10